my title is Fasting to Hasten End of Life. It's a little bit atypical of presentations that we normally see here on Friday mornings. And what it describes is a phenomenon usually in palliative care or hospice medicine with a patient who has end-stage terminal disease, typically oncologic or neurologic, although not exclusively. And that person decides that their level of suffering is so great that they choose to forego any further food or nutrition in order to quicken their death. So objectives for the talk, I'm going to describe an interesting case of a patient I met while I was doing a palliative care elective. I'm going to try to describe how the typical clinical course goes for someone who chooses to fast and try to sort of debunk some misconceptions people may have about starving to death. And then a brief literature review on the topic as well. So first the case. So it was just over a year ago, I was doing a palliative care elective, and Dr. Collins invited me to come with her to a local hospice house to meet a patient who had just begun to fast. And so we went up there in the fall of 2011. We met Dr. H. Like I said, it was a lovely fall day. We were sitting out on the porch of this hospice house. The sun was setting. It was a really nice day. And as we were sitting on the porch, we saw Dr. H kind of wheeling through the garden on his wheelchair, accompanied by his daughter. And he came and sat with us on the porch for maybe 2 or 3 hours. And we had a really long conversation with him about his life, the course of his disease, and how he chose to come to this decision to fast. So Dr. H is 58 years old, and he was diagnosed about 3 years prior with ALS. I bring social history up to the forefront because I find it so pertinent with him. He had previously worked as a successful physician. He had been married 3 times. His first wife died of cancer, and actually his second wife also had ALS. He had worked as the primary caregiver with her during her disease and up until her death with the assistance of hired help. But he was the primary caretaker for her as she died. And I'll get back to how important that probably was for him. And then currently he was remarried to a 3rd wife, and he had a daughter who was 23 and a son who was 29. So his clinical course was actually very typical for ALS, slow progressive decline in his motor function over about 3 years. About a year in 2009, he was no longer able to drive, and he had to retire from his medical practice. Another 2 years, about 3 years in, with progressive deterioration of his motor function, he became Hoyer lift dependent for all of his activities. Interestingly, I note that his bulbar function was still intact at this point. I say physical exam here a little tongue-in-cheek. I certainly didn't auscultate his lungs when we met him. Mostly just to give a description of how he looked when we met him. He was sitting up comfortably in his wheelchair. He was, I don't want to say hefty, but well-nourished. He was sitting in his polo shirt and his gym shorts. You could tell definitely that he had very little power left in his arms and legs. He still had some in his hands that was able to move his electric wheelchair around. He was unable to move his legs. His daughter had to get up a number of times while we met him to reposition his legs for him. And you could see his Foley catheter bag peeking out beneath his gym shorts. And then I note also that he had no dyspnea and no dysphagia. I pulled out some quotations from the conversation we had with him. One, because I found them so pertinent to his case, and also because he said them in front of his daughter who was sitting there with us. He said, "I've lost all the things I love to do. I've lost my medical practice, my boat, my clothes, going out to dinner. I wake up and try to find things to fill 15 hours in a day. I'm bored. I don't want to prolong this a single second. I wish I bought a gun many years ago." And so that sort of brings us to the triggers. Why did he begin to fast? I think from the quotations, the first 2 are very obvious. He lost all of the activities he liked to do. He lost all of his independence. He was dependent on a Hoyer lift at that point. But how did he actually get this idea? How did it get into his mind that he could fast to hasten the end of his life? And actually what we found out was he had conversations with an ALS support group, and the head of that group came and listened to him, listened to his goals, and he gave him the idea that to achieve this goal, maybe fasting is something you might want to think about. And so then how did this actually begin to happen? He moved into a hospice house in June of 2011. He had his last food or drink on Monday, September 19th. This is interesting because this gap of a few months between the start of the fast had to be delayed because the hospital he had worked at had a ceremony honoring him and a wing dedicated in his name. So he actually had to postpone the fast until September. I mentioned that he discontinued medications. When he went into the hospice house, the only medication he really was taking was baclofen for muscle spasticity. And so he had to be counseled that, of course, baclofen was not going to be life-prolonging in any way. It simply was going to make his course more comfortable. And he eventually started to begin to take his medication again. His clinical course in the hospice house, it started with many meetings and counseling sessions. First of all, for the hospice staff, these were nurses who were not very comfortable and not very familiar with this topic. And they had to be sort of counseled on how to treat this patient. They didn't know, do I bring him food? What do I say to him? What do I offer him? And they came to the resolution that they would come and just say, can I get you anything? The patient and his family also needed extensive counseling, as you can imagine. The nurses recalled that a couple times his 29-year-old son referred to it as assisted suicide, which made the staff very uncomfortable. They didn't feel like they were complicit in this. They were simply trying to carry out his wishes and make him as comfortable as possible. Throughout the course, he continued to be offered his PRN medications, which he actually took very little of until close to the end of his life. I met him right around day 3, and at that point he was taking small sips of water, one just to alleviate oral dry mouth, and then also to take his medications eventually. And he did experience some dry mouth, but he experienced also excellent oral care, which was able to alleviate most of that. And he went on like this for a number of weeks. When he had met the counselor from the ALS support group, he had told him he might be able to expect a 2 or 3 week decline before his death. Later down the road, it was about week 5, and he had been quite comfortable progressing along, and he began to show increasing signs of frustration. He had a very slow decline. He was expecting to have passed away by then, and he was still pretty vivid, pretty active. So he was frustrated with his slow decline. He remained comfortable until about the 8th week. During the 8th week, he started to experience some mild intermittent confusion. And then at the end of the 8th week, he sort of entered the active phase of dying. He was pretty comatose for about 3 days, and then he passed away on November 14th after 62 days. And he was actually quite comfortable during the last few days of his death. I specifically mentioned the 62 days there because during my research, I found some literature from Irish political prisoners who had undergone hunger strike. There were about 10 of them, and they were presumably healthy, robust individuals before their strike. And they lasted between about 45 and 75 days, and actually with a mean of 62 days. So the numbers that the ALS support group quoted may have been accurate for someone with an end-stage disease, but maybe not for a robust, healthier individual. So for many of you, this may seem like a curious topic for someone like me to become interested in, and so it actually had some personal significance. That's my Aunt Noreen with my niece and nephew here. She passed away from ALS about a month before I met Dr. H. And I say while she was unfortunate to have the diagnosis of ALS, I'd say she was greatly fortunate because she had 8 sisters who were able to take care of her. And they did so up until she died in the comfort of her own home. And sort of seeing this peripherally from my view, the amount of physical and emotional stress spread over 8 people was so great. I can only imagine what Dr. H went through sort of caring for his wife as the primary caretaker for her. I also mentioned Compassionate Care ALS. They provided Noreen with a number of mechanical